What is a penicillin allergy delabeling toolkit?
So the toolkit contained all of the documentation resources that we needed to undertake the testing. So it had all of the patient information leaflets, the consent forms, allergy risk assessment tool, and questioning tool as well. So everything we needed to undertake the challenge for the patients.
I see. And what did you say to patients and how did they respond?
So when we identified the patients, the majority of them were keen on undergoing delabeling. They understood the benefits to the treatment after we explained it again. So included within the patient information leaflet, they outlined the benefits of losing that penicillin allergy label and the benefits to their future sort of health needs.
Did anyone refuse to participate? And if so, did they give reasons?
There were a few patients that refused allergy delabeling. The majority of patients felt that while they're in hospital with another need or because they're being treated for another condition, they didn't potentially want to extend their stay if the test did not go as planned, but felt they would like it at a later date if it was available.
That makes sense. Can you tell us about the drug provocation test?
The drug provocation test would be to give them a dose of penicillin and then observe them for the hour. So what we tried to do is identify the index penicillin that the patient initially reacted to. If we were able to do that, then we would select that drug and use that as the drug provocation test, take the baseline observations and then monitor the patient for an hour, taking those observations again every 15 minutes. If we were unable to identify the index penicillin, we would use amoxicillin 500 milligrams. Again, do the baseline observations, administer the dose, and then monitor the patient for that full hour.
And presumably this was done with appropriate emergency medication standing by.
So while we're watching the patient, we had an EpiPen available and again, a loud voice to shout the clinical teams if we needed help, if anything did go awry.
I see. And was everybody okay?
Yes, we had no immediate sort of needs or any issues. With two of the patients that we did delabel, they did report some side effects after the dose. That was only in 2 patients.
And were there any harms associated with delabeling?
So with the 2 patients that reported adverse effects, one patient had a delayed skin reaction at day 6. And one patient had an episode of thrush. So the day 6 rash was outside of our parameters. So we would call the patients up at day 5 to check that the test went okay and any side effects or any at that point were reported. So that one patient called us at day 6 just to report that rash. So it's a question whether it's related to the penicillin. And the second patient with the episode of thrush, that may have happened with an alternative antibiotic anyway. So whether that's as a direct impact of the penicillin itself.
And a really important question. How do you prevent the allergy label from reappearing in the future? If, say, somebody looks in older records and finds it and thinks it should be brought back in?
So that's one of the challenges that we faced with this project, and we're seeing going forward that although we delabel the patient and provide the information, that it does reappear on the occasion. So with the study materials, we make sure to provide the patient with an information leaflet so that they can show that to their GP and other healthcare providers. We wrote to the GP and also took their allergy history or label off our system at this point. But we have seen that there's that risk of it reappearing or getting added on at a later date if the records aren't updated in a timely manner. So that's part of the ongoing work to try and change and make that more effective.
And finally, what next? Where do you go from here?
So we've shown that this intervention is safe and effective. We were able to delabel 56 patients overall within that pilot study. So the next steps are to embed this into our standard of care now. So they provide this to all patients if they are able to. So offer this delabeling so they can maximise and again gain the maximum benefit from penicillin antibiotics. So we're working with the clinical teams to understand how to do that. yeah, hopefully every patient that enters a ward will have this available.
Daniel Hearsey, thank you very much for talking to us about this important topic. That really has been very interesting. Let's hope others take it up. For more information about Mr. Hearsey's work at the Royal Cornwall Hospital, please visit our website using the links in the description, and be sure to subscribe for more news, videos and journals. For updates straight to your inbox, please follow the links below. And thanks for watching.